Putting People First is a simple document. It's a vision for people who might need social care in England. But it's a wider vision. It's a vision about the kind of society we want to grow old in.
It spells out the vision and commitment to the transformation of social care over the next 5 to 10 years through personalisation, prevention, early intervention. It's different because it's a policy that is genuinely co-produced with the people that are using services. So signed by 6 government departments, but also very much owned by the social care profession and by people using services. It's very much responding to the kinds of things that they've said they want.
Well, I think it's a massive change. It's as big a change as in the social care side as the community care reforms of the mid-90s. But to be honest, it's much bigger than that, because this is really about a change in societal approaches to care and support for people over the next 20 to 30 years.
It focuses implicitly on the importance of the individual, recognising that though you create the environment in which people are going to live and have opportunities, each individual then experience that in their own way, and we need to make sure we've geared our responses in that personal way, recognising the wider issues.
Putting People First has got 4 main themes which describe the full scope of the policy. One of those is early intervention and prevention, which is about both preventing people from coming into the system in the first place by putting the right kinds of health and well-being services in to support the whole community, but also to stop those that are in the system from requiring more intensive care and support.
There is evidence that if health and social care work together, we can actually prevent people from needing longer-term care.
The next theme is choice and control. This is about personal budgets and about offering people a greater stake in determining the kinds of services that they want and need to meet the needs they've been assessed as having. But it's about a lot more than that as well. It's about services responding to people and their wishes in person-centred and more flexible manners than they have to now.
To help people when they do need services, to ensure that they can control the kind of services they get that best suits their needs, giving people choice and control.
The next is about social capital. It's about what local authorities and their partners can do to develop people's informal social networks so that they can draw upon regular kind of community-based organisations, their friends and their families, in addition to or instead of the kinds of statutory services that they draw upon.
As we deliver all of these services, we're building within the capacity of communities. We don't just deliver social care outside of communities, which may be what we did in the past.
The final one is universal services. Universal services, I think you can look at in 2 ways. It is the responsibility of the local authority and their partners to ensure that there is information and advice available to everybody about the care and support services that are available within their community. But equally, it's about working to break down barriers for accessing regular kind of everyday services like transport and leisure for those with care and support needs.
The things that everybody should be entitled to in their communities, which is a combination of the kind of communities they themselves live in, opportunities in those communities, access to information and advice, access to good quality housing, opportunities in employment.
I think putting people first is critical for a number of reasons. Some of those are to do with the financial, demographic and expectational pressures that social care finds itself in. It has to change. We need to do things differently because the current models for delivering social care aren't going to be sustainable in the next 5 to 10 years. But equally, it is about responding to people's aspirations for the kinds of services they want in this century. They want more choice and control in how those services are delivered. They want a greater degree of investment in how those services respond to the needs that they have.
It's important because we have an ageing population, we have increasing numbers of people with disabilities in our communities. It's important we create a society where we can address and support people through age, through disability, through recovery from mental ill health.